you told us, the human body is an integrated system. Yet our modern medicine must be divided into specialties. So is pan-vascular integration essentially correcting the flaws of specialization or creating an entirely new paradigm of medical understanding?
Yeah. Well, specialization is important. I mean, we've made great progress in all of the specialties. And the progress is so rapid, so advanced, it's very difficult for any one physician to understand all of the advances that are being made. So we have to rely upon our specialists to help us take care of the patient. But I think the internists that take care of the entire person are the true heroes in the medical profession, because they do have to integrate all of these issues. Is it a new problem? No, it is an increasing problem though, because the specialists are getting so specialized that it's very hard to integrate medical care. I'm not sure what the answer is. Maybe AI will help us integrate findings so that we can consider the whole patient.
So I want to ask Professor Lee, from your clinical experience, what is the biggest internal tension in implanting the pan-vascular concept? Is it resistance from specialists or a lack of systematic incentives for integration?
See, it's a tough question. For me, and I will quote another Chinese old sayings, my life is limited, but the knowledge is unlimited. Yes, I fully agree with you. We really need pan-vascular, the whole concept. But for each people, for each doctor, he must focus on one specialized because he has limited time. I know you have already said you treated the patient with peripheral artery disease. Most time I treat patients with coronary disease. But if I have time, I will talk with my colleagues in the other specialties. For example, for some really rare case, I will talk with my colleague with maybe cardiothoracic surgeons, vascular surgeons, or neurosurgeons, gynecologists, ask them for advice. So I think it's time, if possible, we should build up MDT. MDT is a very useful tool to help us to reorganize. In our division, unfortunately, we don't have MDT for pan-vascular disease, but we have MDT for the rare heart disease. We have radiologists, we have echocardiologists, we have pathologists, and our cardiologists and the cardiothoracic surgeons. If we find some rare case, we can talk with each other. We have a weekly meeting. Maybe it doesn't need too many times. Maybe 1 hour, 2 hours, that's enough. We just share with each other what we see for this patient from their own specialties. How do they explain the patient? We can study from each other and make the patient live better. So I think build a good MDT is very useful for treat the patient with pan-vascular disease.
Great. We appreciate your great work.
你好，中国，东方问道。